Hi, my name is Ricardo Vialta, and this is my hot topic presentation on mental health. Let's start with defining mental health and what it actually means. The definition of it is the emotional, social, and psychological well being of somebody. I'll be getting into it later, but mental illness refers to the mental, behavioral, or emotional disorders. This is from the National Institute of Mental Health. Now, according to the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, it's just the place where psychologists and psychiatrists go to diagnose disorders. According to that, there are over 20 different types of mental disorders. Some of the more popular ones that we hear more about are autism, schizophrenia, bipolar, post-traumatic stress disorder, obsessive compulsive disorder, ADHD, etc. And each type are treated differently. Some treatments include therapy, medication, hypnosis, and the list goes on. The next question is, how does mental health relate to our students? Well, here's some pretty interesting statistics. 1 in 5 students live with a mental health condition, ages 13 through 18. So an example is if your class has 30 students in it, odds are 6 of them are going to have a mental health condition. Next statistic is that students with mental health conditions, 37% of them drop out, and 70% of our juvenile justice system consists of people with mental health conditions. And this costs the United States roughly $12 billion per year. Another staggering statistic is that 90% of suicides have an underlying mental illness, and that suicide is now the second leading cause of death for the ages 15 through 24. Now, I want to point out that mental health is not restricted to mental illness, so it's not all negative. I want to point out that mental health also concerns the student's strengths, which is how to have a positive social and emotional development and motivation. How is it currently being handled in our school system, you may ask? And there are several different ways, and these are general ways that the general United States public school handles it. There may be private schools that handle them very differently, but these are the overall, pretty much general ways that schools handle their mental health services. First one is through school financed services. This includes the pupil services, where the students can go and get help with the school counselor, school psychologist, school psychiatrist, pretty much anyone related to the student support personnel. The next method is through school district specialized units, and these includes the family clinics and family resource centers. Another way of handling this is the connections that schools have with their community health services, whether the school's contracted a community provider or they've linked up with a local agency. Another method that you may have heard about is the pull-out curricula, which is integrated into the classroom. And this is just a specific intervention that is implemented by a specially trained person. They pull them out and they provide intervention services or support services for those students. And overall, the districts have seemed to become marginalizing and fragmenting mental health support, meaning that overall, the way that families and students can get help is very confusing, and oftentimes they have to go through many different loopholes and different people, different names, and it's just kind of going in circles because there are so many departments and policies. Sorry, there are so many departments that these policies and IEPs have to go through just to get implemented, and many different departments that families have to contact and speak with in order to get services for their students. Why is mental health such an important issue? Well, first off, health problems in general may affect learning and performance. Now, it's important to remember that not every need can be met by a school. But when it affects learning, the schools must meet that challenge. And if teachers can obtain support from the school to provide instruction and adapt to their students academically and behaviorally, I think that this may reduce the amount of teachers that leave the profession in such a short amount of time that we're seeing. Some of the support could look like additional seminars, classes, training, just so that teachers can get a hold of how to deal with behaviors from students with mental conditions and also how to recognize them. Another reason why it's such an important issue is that schools may become more open to adopt specific programs if they address students with mental health conditions and make it a priority. Another big issue is that families can finally get access to mental health services through the school if the school puts a stronger focus on their mental health curriculum. What can educators do to help? While I was researching this question, there was no easy answer. This is a bit of a gray area. There was no one size fits all. And so I created this list, which I believe to be one that is very helpful and very supportive in terms of helping students that have mental conditions. And the first way that educators can help those students is by providing health support and services beyond special education. This means that school administrators can perhaps come up with some policies that create a different path for students who have mental health conditions to get help. Currently, a lot of the times, students with mental health conditions, such as, just an example, bipolar or anxiety or depression, the parents would have to argue with the school to get special education, and that is a much tougher route. Like I said, there's a lot of loopholes, there's a lot of different departments, and it's just a very tough process to get a student into special ed if they don't have a pretty substantial and obvious need for the program to accept them. If schools can find a way to provide some type of mental health support for the students without having those students go through the hassle of needing that special education or needing that intensive IEP, I think that could help. Another way is by improving collaboration between school and community to integrate mental health care. This goes back into why it was an important issue in the first place. If schools in their community can collaborate together, I think it can help both the schools, the families, and the community become more centered on the mental health that the locals are struggling to deal with, and helping the families in that community. Also, helping to ensure a positive and safe class environment for health. Another way that educators can help is that teachers can consider setting aside time for the improvement of mental health. For example, Setting aside time in class for meditation or yoga or class discussion for current events or even quiet time. Uh, Studies have shown that these kind of mental health exercises dramatically improve student performance and decrease maladaptive behaviors. Other things are setting goals and expectations so that students know what to expect and when to expect it to decrease procrastination, decrease stress levels, especially in times of finals or times like that where things might get hectic in the students' schedules or students that also work. This could, in adapting to their situation, could help them adapt, improve their well-being. Also, giving students opportunities to express themselves and converse with others could help improve, going back to the positive class environment, improve self-confidence and self-esteem, and conversing with others, helping them grow and making friends potentially. And the last thing I have on here is checking in on students whenever you can, and how they're doing in any way possible. And if you have any concerns, going to the administration or contacting their family to see what you can do to help them, or perhaps it could be an undiagnosed type of situation, to where the student may need some serious intervention. And then next, I just have all my sources that I've used, and I hope you enjoyed this presentation. Thank you very much.